Hello everyone, welcome to Talking Health with Dr. Laz, your favorite health program on television, reaching you from Abuja, Nigeria's capital. My name is Dr. Laz Eze. Yes, COVID-19 is still raging and stretching everything about our health sector, not only in Africa, but everywhere around the world. And of course, issues around access to healthcare has become very topical. And of course, you know that in many developing countries, including Nigeria, access to quality healthcare has been very problematic. COVID-19 has quite made it worse. So today on the program, we're going to continue the conversation from where we stopped. We know we talked about telemedicine in the past program. So we'll talk about insurance today, health insurance, and its relevance to improving healthcare anywhere in the world. But in focus will be how Nigeria healthcare sector is thriving under the National Health Insurance Scheme and the recently established state health insurance agencies. So to join me on this program today will be two health experts who have the Executive Secretary of the Health Insurance Agency in one of the states, and also a civil society person who is going to bring our insight on what they think about how well we're doing and what we need to do better. So we're going to take a break, and when we return, I'm going to be introducing my guests further. But please don't forget to follow us on our social media handles displayed right on your screen, and subscribe to our YouTube channel so that you can always watch both this program, the previous one, as many times as you like. Do stay with us. We'll be right back after this break. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, I have with me in the studio Dr. Simeon Onyemechi. He is the Executive Secretary of Anambra State Health Insurance Agency, as well as Special Advisor to the Anambra State Governor on Health. Before his recent appointments, he was a Senior Medical Officer at the Federal Ministry of Health here in Abuja. You're welcome, Dr. Onyemechi.
Thank you so much, Dr. Laz. It's my
It's glad to have you.
Here.
Yes. Also joining us via Zoom will be Anuro Timi. She's the Program Manager of Health Reform Foundation of Nigeria Health Fund, as well as the FCT Team Lead of Make Our Hospital Work campaign. You're welcome to the program, Anuro Timi.
Thank you, and my pleasure to be here today.
Thank you. So excited to have both of you, and we go right into the conversation. Let me start with you, Dr. Onyemechi. Health insurance, what does that really mean? Whenever a lot of Nigerians hear about insurance, they usually say, God is my insurance. So why do people need health insurance? What is it all about? Let's take it off from there.
Yeah, thank you so much. Health insurance, I rather would like to put it in a way that it mirrors our traditional Isusu or Osusu, depending on wherever you come from.
Is which language?
Depending on the language. Either you are an Igbo man and you say it's Osusu.
Okay.
And then if you are from around the old Midwest, they say Esusu and all of that. But these are contributions that happen among group of friends, sometimes persons who may not be friends, but then are related by some form of social contract. And then these individuals come together to contribute money, maybe 10 of us, and then every month, one person will get all of our contributions to be able to solve a meaningful problem.
Okay.
Now, that's the same concept of health insurance, whereby we all put our monies for our health care into a single pool, hoping that we all will not get ill at the same time. But whenever Mr. A falls ill, the monies that have been contributed by Mrs. and Mrs. A to Z would be used to take care of the healthcare needs of A, and vice versa. Now, when we understand that basic concept of insurance, then we realize that every day must not be my own day of drawing from it. So that the notion of health insurance not being a welcome development will cease in our environment. But suffice it to say that health insurance is a mechanism through which individuals prepare ahead of time for access to quality health care in such a manner that whenever they need it, they will access health care without the traditional cash and carry healthcare system that is practiced in most of Africa and ditto for Nigeria before the advent of health insurance. Because at those kind of times, you may have a lot of barrier to finances that will make you not to now access quality health care, and that gives rise to a lot of the negative health indices that we have in sub-Saharan Africa. Thank you.
Okay, thank you very much. You've tried to break it down using what a lot of persons already know. So in essence, it's like we have a basket and everybody is dropping something.
That's right.
Over time. Yeah. So when you need it for health, you get to use it.
Exactly.
Okay. So let me quickly get to Anurotimi. Yes, the Health Reform Foundation of Nigeria is the Secretariat of the Health Sector Reform Coalition that has been pushing strongly for implementing the Basic Healthcare Provision Fund as required by Section 11 of the National Health Act. So I know you're kind of in a hurry. You leave us before the end of the program. So I would like to know from you, what's your perception of the implementation of the Basic Healthcare Provision Fund, whose 50% is to go into health insurance for Nigerians?
Okay. Good evening, and thanks for having me on this program. I'm very delighted to be here to speak about an issue that I'm very passionate about, because when the Basic Healthcare Provision Fund is implemented, it will actually enable a lot of Nigerians, especially those that cannot afford to pay out of pocket to access care. The low earners, the vulnerable groups. So if we're talking about level of implementation, we all know that the National Health Act, which gave birth to the Section 11 of Basic Healthcare Provision, for which the basket funding took 10 years to be enacted in 2014. And for the first time, the government made a provision for the funding in 2018. And if we look at the way the funding has been released in terms of implementation, the 2018 to 2019, we could really access about 50% of the funds, as of that time. By 2020, we are glad that the funding now moved away from the service-wide fund and was now made a statutory budget allocation. But even looking at this conversation, it's about are people who are meant to access the fund able to access the fund. I can basically tell you as of now that we've not been able to, we cannot convincingly say that Nigerians are happily accessing the services that they are meant to access through the Basic Healthcare Provision Fund. We also acknowledge the fact that at the onset of the implementation, there were some fragmentation in terms of how the program implemented, and there was an advocacy that talked about integration of the Basic Healthcare Provision Fund into the existing health system. And you know that by end of last year, the Basic Healthcare Provision Fund guideline was relaunched, and some actions have been taken. But for us to really say that we are really on the pathway to say yes, Nigerian those vulnerable people, the vulnerable Nigerians, will no longer have to suffer the burden of health care payment, is when we see that all where they are able to access this care, which as of now, it is not what it is.
All right. Thank you, Anurotimi. I'm not sure if Dr. Nyemechi would agree with you that about the access to the Basic Healthcare Provision Fund. So, but let me get what you have to say to that. You know, there's been a lot of concerns from a lot of professionals and Nigerians alike. In 2018 was the first time Basic Healthcare Provision Fund was budgeted, 55 billion naira. 2019 was 51 billion naira. 2020 was 45 billion naira, which was later reduced to 25. Then 2021 budget, 35 billion was approved. So and is in view of the need to reach all Nigerians with health insurance to achieve universal health coverage that the state health insurance agency were created. So how much has your agency kind of received from the Basic Healthcare Provision Fund to provide health insurance to the people of Anambra?
Yeah, thank you so much. And I would want to agree with the Health Fund CEO's submissions
Program
on the
manager.
bottlenecks that we had in the implementation of Basic Healthcare Provision Fund in the country, culminating in the recently launched guideline. But then there are still a lot of gray areas. However, a lot of us state actors have decided that, look, we just have to start somehow. Whatever it is, when we begin to implement, when we face any challenges, then we go back to the drawing board and then relaunch and leap even further. But to say that, given the fact that the premium for the benefit package in the Basic Healthcare Provision Fund is put at about 12,000 naira. Okay. In Anambra State, for example, what we received for the NHIS gateway is about 338 million naira released so far. When you divide that by 12,000 naira, you realize that we can cover 28,246 vulnerable individuals.
Okay.
Out of a population of about 6 million. And when you look at the fact that the Anambra State Health Insurance Agency, ASHIA, through the scheme that we are currently implementing with the support of His Excellency the Governor, we currently have over 95,000 enrollees, almost 100,000, out of which those from the informal sector in our scheme currently stand at about 36,000 individuals paying their 12,000 premium or have been adopted into the scheme by those who have the means. Okay. So if I currently in Anambra State, I am running over 36,000 informal sector individuals.
Okay.
And this Basic Healthcare Provision Fund that is coming for Anambra State, given the amount that we got, is going to cover 28,246 individuals. Your guess is as good as mine. That will only scratch the surface. Okay. So, to that extent, all of the expectations that the Basic Healthcare Provision Fund will be the magic wand that will do all manner of trick, we have to, as a country, implement that. But bear in mind that for us to get to the point of achieving universal health coverage that is clearly captured in the Sustainable Development Goals 3 Target 8 will be for us to go and have innovative approaches to financing healthcare through healthcare insurance, like the adoption model that Anambra State is using to get an unprecedented number of 36,000 informal sector individuals, because the BHCPF is one of the vehicles, but will definitely not get us to the destination of UHC. Thank you.
Yes, you're very right. We'll get to learn more about these models. Rotimi needs to get into another meeting, but let me quickly get her thoughts on, tracking or following as a civil society organization. What are you doing in this regard? There are about 35 state health insurance agencies at the moment, and CSOs are expected to at least support with monitoring. So as make our hospital work following the service delivery, or as Health Sector Reform Coalition, what is the plan on ground, or what are you doing already?
Thank you so much. So in terms of tracking the Basic Healthcare Provision Fund, a lot of engagement at home. First foremost is that capacity building are ongoing for civil societies across the various states to ensure that we understand that where the funding and how the funding will be dispersed and what the funding will be used for. And that is actually going on. And looking at what F1 is doing, F1 is actually, we are actually in all the 36 states federation. And one of the key roles that the guideline has made provision for is the inclusion of civil society on states coordinating oversight committees. Now that will provide the opportunity to ask critical questions, to hold the system accountable. We don't want a system of attracting and holding them accountable on when the events or actions have been taken, but rather ensuring that the right things are done even before the rollout. So this has provided us opportunity to be able to ask critical questions. And also, part of the efforts collectively with the coalition is periodic engagement with the various policy holders, the various leadership from the states down to the federal level, holding the various gateways accountable, holding and having engagement with them. One of the pipelines is for us to have a scorecard.
Sorry, I'll have to cut you. We need to take a break and also allow you to join your other meeting. Thank you very much for joining the program. We'll take a break.
Thank you.
Yes, Anuro Timi is the FCT team lead of Make Our Hospital Work, as well as campaign, as well as program manager of Health Reform Foundation of Nigeria, HEFON. So thanks for that insight. So, but we expect the civil society to do much more. So stay with us. Let's take another break. We'll be right back shortly. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, Dr. Onyemaechi, let's have the remaining parts of the conversation. Just for the sake of Nigerians who may not understand, we'll be mentioning Basic Healthcare Provision Fund. It's actually a provision of the National Health Act 2014 that is meant to provide not less than 1% of the federal government consolidated revenue fund every year to support provision of primary health care services as well as health insurance. So of this fund, 50% will go to support health insurance, 45% will go to National Primary Healthcare Development Agency to support training of healthcare workers, procurement of essential drugs, and 5% will support emergency medical care. So you mentioned 28,000 from Basic Healthcare Fund, and about 36,000 from informal sector. So from my understanding, the Basic Healthcare Fund is not to sort everything. It's just to support the states. So the states on their own are supposed to have their own fund. So far, how much has the Anambra State government, dedicated to provide health insurance from Anambra people, since we now have around 56,000 or thereabouts from the basic healthcare and the informal sector?
Now, it's clear to understand that Anambra State, for example, what we are doing with ASHIA in Anambra, a pet project of His Excellency that has been entrenched in a manner that even when he leaves office, there's a law backing it up, such that it has become institutionalized, whether he's there or not. The scheme is there to serve the people. There is a provision for us in our own law of minimum 0.5% consolidated revenue of the state being channeled to the scheme as equity fund. And for us, as an agency, we have registered about 10,000 people from the equity funding of the state government into the scheme. But that's not the catch. The catch is this: we need to, as a people, understand that to make access to quality health care possible for our people without financial burden, without catastrophic health expenditure, will be for us as individuals to collectively agree that there is a need, like in civilized societies, to make health insurance policy cover mandatory. When we make health insurance policy mandatory in Nigeria, let me take Anambra, for example, where we have about 6 million people. If we make it mandatory, currently our premium is 1,000 naira a month, and we have almost 100,000 people enrolled. When it becomes mandatory and a lot of funding will come in, the actuarial analysis will definitely crash the premium to maybe 300 naira per individual per month. And at that time, you get a lot of funding. Once you increase the fiscal space through bringing in a lot of people, you can now have a lot more money. Once there's accountability and transparency framework set in motion to ensure that these funds are used judiciously, the people will get quality health care, but people pay something,
People
just like
must
it's done anywhere in the world.
People must pay something, yes. But a lot of persons are concerned with the experience of NHIS. So since 2005, when NHIS started, you know, we don't know the number of Nigerians that are covered. We hear 1%, 5%, less than 5%. You know, so how do you allay such fears? And one might also want to say that Anambra State money just catering for 10,000 persons is too small. If federal is providing resources that is supporting over close to 30,000, one would have expected at least the resources coming from the state government to, at least for a start, to be not less than 200,000. How will you react to such?
Yeah, I will react to such to say clearly that you will not go above your budgetary provision. The law is clear. 0.5% of the Consolidated Revenue Fund of the state. It's in the law. The federal one says 1%, which is the basic healthcare provision fund.
1%.
Not less than 1%. But what we got is half of the 1%. So what we got from the basic healthcare provision fund of 2018 is about 0.5%.
Have you gotten from
date.
2019?
No. Nobody has got
2020?
releases for 2019, 2020. What we are talking about is this 2018 funding. And for our state...
Sorry, I'm sure our viewers will be kind of interested in this.
Yeah.
We have like 3 minutes to round up. So 2018, we are in 2021.
Right.
So you've received, your agency has received just 50% of the budget of 2018
Right.
for health insurance.
Right.
Okay, I know you have a lot of things to say, but we are really constrained by time. So just before we round up, the health insurance thing, you said Anambra State law is 0.05%.
0.5.
0.5%. Many will argue that it's too small.
There are states that don't have at all.
Would you want to recommend a review of that law to
When you
say as
have-
much as say not less than 5%?
That is desirable. Given my background,
the what COVID-19 has brought into the space and has made a lot of persons economically weaker.
I think the focus should be for us. How do we innovatively fund healthcare?
Okay.
And that's
so
exactly what we are
suggestions.
doing in Anambra, for example. Informal sector lives, as we speak in Nigeria, no state can boast of 36,000 people paying their premium out of pocket on their own, except for what we have in
And by
Anambra.
informal sector, you mean?
People, traders, wheelbarrow pushers, the farmer, the artisan, and what have you, having confidence, paying and renewing. What we have to do is to make our health insurance schemes at the state level to work. If it works and people see evidence, like we have in the state, where I'm giving you my numbers, that these are the numbers we have, that can be confirmed on the platform. It's easy for me to come and say we have covered 2 million persons, but that would be a lie. What we have covered is those numbers, and nobody can tell you in the health insurance business in this country that 36,000 artisans and peasants have paid for insurance, and it's not a big deal. That for us, it's a big deal. It will be desirable to even say 50% should be put for health insurance. But this is to take care of equity funding. The health budget is still there, really about 15%, taking care of every other thing in the health sector. This is to support those who cannot pay for themselves. And since the year 2018, the governor has consistently released that amount, and we have put in these people and have kept them on the scheme.
I'm so sorry, I'll have to cut you. So thank you very much for this insight. I think we'll have further conversations around health insurance coverage. This is just for a start, So, but I'm really glad that you brought the insights from the state level. On this program, we're going to be following more both the National Health Insurance Scheme and every other person. Thank you, Dr. Simeon Onyebechi, Executive Secretary, Anambra State Health Insurance Agency, and Special Advisor to the Governor on Health. Thank you very much for joining us today on the program. So much to talk about, but of course, we always have to work within the time you have. We're going to continue with the conversation in the coming weeks. How do we make healthcare, quality healthcare, more accessible to as many Nigerians as possible? My name is Lars Eze. Do stay with us. See you again next week. Bye for now.